The association of laser technology with flexible ureteroscopy represents an important progress in the surgical treatment of urinary stone disease. This new technology is still developing. The materials are fragile and expensive. In this film, we discuss the rules to be respected in order to preserve longevity of the materials and to avoid injury to members of the surgical team. In spite of their flexibility, one should know that the fibers are made of silica, and the finer their caliber, the more fragile they are, particularly during sterilization. We prefer using a box made for this purpose and not a classic sterile bag. The proximal extremity of the fiber, incorporated in a connector and protected by a cap, will not be unscrewed until just before connecting it to the generator. Every contact or contamination of the extremity of the fiber can induce carbonization or rupture during injection of laser energy. To prevent the fiber from becoming entangled, we unroll progressively. The nurse unscrews the cap and connects the fiber to the generator without too much tightening. With the generator we use, the fibers are suspended to a small pillar to diminish the risk of rupture at the base of the fiber. To assure a stable position of the fibers on the installation table, we cover them with wet compresses. Every person working in the proximity of laser should wear protecting glasses. The nominal distance for eye safety of the holmium laser that we use is at 82 centimeters. This distance is reached when the arm is completely extended, but not during the surgical intervention. Once the laser is activated, fiber integrity and energy transmission are verified. If the fiber is intact, the laser bundle is round and sharp. The laser is again inactivated before introducing it into the ureteroscope. The scope is placed as right as possible to avoid damage to the working canal. Similarly, if the fiber is introduced when the scope is already in the kidney, it is prudent to verify the straight position of the scope by radioscopy. How to choose the fiber that will be used? 4 parameters should be considered: the flow, the loss of flexion, the minimal curve, and the energy heat. During the whole intervention, irrigation is necessary, especially during stone fragmentation, when the snowstorm effect deteriorates the quality of vision. We use a peristaltic pump. The flow of irrigation is inversely related to the fiber diameter. The flow diminishes from 50 milliliters per minute without a fiber to 35 milliliters per minute with a fiber of 200 micrometer and to 20 milliliters per minute with a fiber of 273 micrometer and only 8 milliliters per minute with a fiber of 365 micrometer. To assure the tightness of the fiber, we use a joint. The more recent ureteroscopes can curve to up to 270 degrees. This flexibility decreases when the fiber is introduced. In 2 different ureteroscopes, the degree of flexion passes from 270 degrees to 225 degrees with a fiber of 273 micrometer and to 180 degrees with a fiber of 365 micrometer. The curve of the fiber also plays a role in the propagation of the laser bundle. The fiber is constituted of a silica core surrounded by a cladding and a sheet. Schematically, the bundle passes through the silica core and reflects to the cladding like a mirror below a critical angle. Once this angle is passed, the bundle crosses the sheet and leaves the fiber. A rupture of the fiber, or worse, a perforation of the working canal of the ureteroscope, can occur. Practically, the maximal curve of the scope for safe use is defined by the minimal curve. For each fiber diameter, the constructor provides the minimal curve that corresponds in our case to 40 mm for fibers of 200 micrometers, to 30 mm for fibers of 273 micrometers, and to 45 mm for fibers of 365 micrometers. The maximal power that can be injected in a fiber depends also on the diameter. Often, these parameters are programmed by the constructor. For example, for a hard stone, the power passes from 20 watts for fibers of 365 micrometers to 16 watts for fibers of 273 micrometers and to 11 watts for fibers of 200 micrometer. For all these reasons, we often use fibers of 273 micrometer for the fragmentation of stones. These fibers are a little less flexible than the 200 micrometer fibers, but stronger and with an acceptable irrigation flow. For the section of tissue, like in, for example, an endopilotomy, a more important level of power is useful. The fiber of 365 micrometers is more adapted. The organization of the operation theater should be ergonomic and rational. For example, we place the pedal of the radioscopy at the left foot and the pedal of the laser at the right foot of the surgeon in order to avoid accidental laser firing. To treat stones, two methods of fragmentation exist. The first consists of vaporizing the stone in the form of a stamp by firing at the peripheral surface of the stone. Like always, the fiber should pass the ureteroscope for at least 1/3 of the field of vision to avoid damage to the optics of the scope. Here we observe the effect of snowstorm and the accumulation of sand at the fundus of the renal pelvis. At the end of the intervention, some fragments are captured for spectrophotometric analysis. The second method of fragmentation consists of cutting the stone in several fragments, small enough to be extracted by a dormia through the ureter. At the end of the intervention, the extremity of the fiber is systematically refreshed. We use ceramic scissors and a stripping device. The fiber is first cut and then stripped over 5 to 10 millimeters. The silica core is delicately marked by a turn of the scissors and separated by digital traction. After disconnecting the fiber from the generator, the cap is screwed on the joint. Then the fiber is enrolled. The radius of the roll should be 10 to 12 centimeters. Finally, the fiber is put in the sterilization box. In conclusion, respecting the rules of utilization of the laser in flexible ureterorhinoscopy allows optimizing their use and prolong their life.